Wellness, Mental Health, and Awareness Night here at Superior High School. We're glad that all of you who are here were able to join us tonight. We are looking forward to having some information shared with us by a number of people tonight that we feel is relevant to some of the things that we're all facing in our community and that are important things to be talking about. So we're going to have some conversations about mental health. We're going to also have some of our students who are involved in groups at the high school come up and share some of the things they're doing around supporting mental health and substance use issues. And we're going to close it out with some reflection and updates kind of about where we are a year out from what we presented last year when we talked about opiate use in our community. So a chance just to see where we have made some gains and maybe some things that we're still needing to work on as a community. So thank you so much for being here. Those of you who are here, those of you who might be at home listening, thank you as well for jumping on and being with us this evening from home. So to get started, I'd like to introduce myself. I'm Jane Larson. I'm the social worker here at Superior High School, and glad that I could be here tonight to help kick this off. So we're going to start our evening tonight with a presentation by Liz Amos about why mental health matters. This is Mental Health Awareness Month, the month of May. Every May we celebrate mental health awareness and work toward doing things that we can do to improve mental health for all of us in our communities. So Liz is a certified inner alignment coach and a yoga teacher. And founder of One Love Collective. She's an active member of our community who's passionate about mental health and doing things that help people be as healthy as they can be. So we're grateful that you're able to be here tonight, and I'm going to turn it over to you. Thank you, Liz.
All right, well, good evening, and thank you. I am grateful to be here and share space with you all. And mental health and substance use can be such a heady topic. So like Jane said, my name is Liz Amos. First and foremost, I'm a mom, and I'm so excited that my two kids get to be here to see me present tonight because they think I just go meet people for coffee and hang out on the computer all day. So I'm grateful that they're here to see this and grateful for you all for taking the time to show up tonight. I can tell that you all have really big hearts and you are also passionate about mental health and substance use. So thank you for coming out to support yourselves, support your families, and support your communities. That means a lot. But before we get started, I would just like to offer, because maybe we've had busy days and however we've arrived here tonight, that is totally okay. But I'd just like to start off with a little centering. So if that feels good to you, if you'd like to maybe place both of your feet on the floor, kind of settle in, or as I like to say, get cozy into your nest there, your space, take up space. And if that feels good to you, maybe perhaps begin to flutter the eyelids close or soften the gaze. And begin to connect with your breath, just noticing where it's at. No need to change or modify it, but just noticing where it's at. And let's take 3 collective breaths together. So as you inhale, filling through your belly, your chest, your upper back. Open mouth, exhale, sigh it out. Again, big inhale. Fill, expand. Open mouth, exhale, and release. Once more, big inhale, maybe the biggest breath of the day, perhaps another sip of air at the top, and exhale, let it all go. And as we arrive here tonight, perhaps setting an intention for this evening, maybe it's to learn something new, or to honor wherever we are at in our journey as a parent, as a student, as an educator, knowing that we are showing up each and every day, doing the best that we can to support ourselves, to support others, and to support our community. And then option if you'd like to bring your hands together to heart center. And then sealing that intention in with, and so it is done. And then whenever you're ready, if you'd like to, you can blink your eyes back open and come back into this space. So again, welcome. Yes, so mental health is very near and dear to my heart. Yes, like I said, first and foremost, I'm a mother, I'm a certified inner alignment coach, yoga teacher. I've had my own experiences and struggles with anxiety and depression, and I have family members as well who have mental illness, so like I said, very near and dear to my heart. But some of these things that I might share tonight, maybe you already know, but sometimes it's nice to have just a gentle, loving reminder of the great things that we are already doing, and maybe learn something new, whether it's to support ourselves, like I said, or support our loved ones too. All right, so yes, why we're here. Mental health affects all of us. We all have mental health. So for a lot of us, we have a lot of pressure that we might place on ourselves to kind of hold everything together, keep it all in, and yeah, just carry the weight of everything and kind of keep that inside of us. But sometimes it can be hard because everybody might feel like everything's fine on the outside, but on the inside we might really be struggling. And just knowing that we're not alone. So today, it's not about judgment. It's not about trying to fix anything. There's nothing, quote unquote, wrong with you. But there's just different ways that we can learn to cope or support our mental health and support others who might be struggling with their mental health and are looking for help and support as well. So yes, the bravest thing that we can do is ask for help when we need it. And sometimes that can be hard. I do recognize that, but it can be very encouraging and empowering to reach out to somebody that we trust and know to support us on our journey, because we don't have to do this alone. Yes, so mental health is health. So first and foremost, when we're sick, like we break an arm, we break a leg, what do? We go to the hospital, we go get it fixed, right? But with our mental health, if we're struggling, sometimes we keep it inside, and sometimes we don't reach out to somebody. But wanting to make it okay, just as normal as we would go to the doctor if we were to injure ourselves, that if something is feeling off with our mental health, that like I said, reaching out to, whether it's a teacher or maybe a parent, or maybe seeking some outside help like counseling or peer support. There's other different things that we can tap into to really help support us in our journey. Because there is a lot of stigma around mental health too. Thankfully, things have been shifting, I feel like, quite a bit, but there's still that stigma of, I don't want to be the crazy one, or there's nothing wrong with me, it's not maybe that bad. But yeah, just knowing that, breaking that silence and reaching out for help, because help and support is out there. All right, so here's some stats. I won't get too deep into them, but in spring of 2023, the high school put together a survey, and these are the results from that on mental health. So this was a self-reported assessment about mental health and well-being. So they rated it based on anxiety, depression, and self-harm. So for students who had experienced significant problems with anxiety within the past 12 months, in general, overall, it was 53%. So that's pretty significant. As far as self-reported depression, about 34% of students had experienced prolonged disruptive sadness within the last 12 months. Self-harm, students who intentionally harm themselves without intending to die, was about 23%. And then as far as tobacco, marijuana, alcohol, and other drug use was also recorded. And so for those students who were using vaping products in the last 30 days, overall was about 15%. Current use of alcohol, having at least one drink within the last 30 days, was about 18% on average. Any legal drug misuse, so students who had misused over-the-counter and prescription pain medications, was about 12%. Marijuana, again, using in the past 30 days, was about 15%. But just sharing those stats to acknowledge that it's not uncommon to experience anxiety and depression, and that sometimes resorting to ways of coping, like using illegal drugs, marijuana, and alcohol as ways to cope. And so we cope in the ways that we know how. But when we learn other ways to cope that support our health, then that can really be impactful. So the more we know, and we have so much support in our community too. That's why I'm so grateful that there's all of these amazing resources here to really truly support people wherever they're at in their journey. So just some signs to be aware of. Again, not going to get too deep into this, but maybe feeling a sense of overwhelm, exhaustion, or burnout. Oftentimes, it can feel very isolating and lonely at times, or maybe feeling numb or off. But like I said, like struggling doesn't mean that you're broken or that there's something wrong with you. Feeling anxiety and depression is a normal part of life, but that doesn't mean we need to stay stuck in that too. We can learn different coping skills, and like I said, there's resources too. We have some amazing resources that can help. All right, because the goal is building that resiliency so that we can thrive and that we can live the life that we want to. So again, there's many paths that people can take on the road to recovery or supporting ourselves. So it's really finding what works for you. And maybe you might have to try a few different things. So like for example, I tried therapy. I tried a couple of counselors that just really weren't the right fit for me. But I wasn't willing to give up. I found some counselors that have worked for me. I've done coaching. I've done a variety of different things. Yoga. Breath work has been amazing for me as well, but like I say, different strokes for different folks, so finding what works for you. Peer support, so that's people who have lived mental health or substance use lived experience themselves, who are in recovery, so they've kind of been there, done that, get it, who can offer that personalized support and service too. Nature and mindfulness, so going out, like I tell my kids, when I'm feeling really overwhelmed, I'm like, Mom needs to hug a tree, or I need to put my feet in some sand. So we'll go to the beach, or I'll literally go and just hug a tree, or moss can be really grounding for me too. But just finding, again, whatever works for you. Or having a trusted friend or an adult that you can go to too, and just talk about what's coming up for you, to say like, hey, like I'm just feeling really off. Would you be willing to listen to me? Or I'm really needing some help. And maybe that person has the capacity to help, or maybe not able to help because, just like on a plane, you want to put on your own oxygen mask first, and taking care of ourselves is important, and maybe not having that space or that capacity to be able to take on or help in that moment, or maybe not knowing how to help. And again, that's when reaching out and asking for some other help. It's okay to do that. Giving yourself permission to do that, to know that we only know what we know, but we can learn other things, and we can be supported in our journeys. So yes, I mentioned some of the amazing resources. Kudos to the Superior, or the School District of Superior, their website. So if you go on their main website, I checked both the student, the parent, and I think there might be one other tab too, but they have mental health resources there, and they list a lot of great things to plug into and connect with, talking about mental health. It's a really phenomenal resource if people are just curious or want to get connected. We also have NAMI, Lake Superior South Shore, and they are here tonight too, and they do amazing things for our community. They have support groups, they do education, they do awareness. They also recently this year opened Hope Haven Peer Respite Center, which is such a gift to our community. They have a warm line that people can call. So maybe someone feels like they don't have anybody that they can talk to because they're afraid maybe to talk about some of the things that are coming up for them, or just maybe feel like they don't have somebody that they can trust, which I get that. So having somebody that they can reach out to who is non-judgmental, who can listen to them whether they're maybe experiencing a breakup, a loss of a pet, something's coming up for them, yourselves or somebody else, they can give a call there. And eventually, it will be a place where people can go and stay. Perhaps they just need kind of like a little reset, I guess, if you want to think of that, where they can kind of go take care of their mental health, really prioritize, focus on that, work with some peer support staff so they can get back on their feet and get back into the community. Indigo is also another resource too. They are a nonprofit here located in Superior, and they're here tonight as well. And they have peer support services. They provide all services to all disabilities, so mental health, physical health, emotional, sensory, you name it. They have a variety of different things that they can support people with. And then also, this is a number I feel like everybody should have in their phone or have as a resource too, is 988. So this is the suicide and prevention crisis line. So if somebody's in crisis, they can reach out and call that number as well. So just some things to reflect upon, for yourself or for others. What am I doing to take care of my mental health right now? Like recognizing the positive things that we're doing. Maybe it's journaling to be reflective. Maybe it's doing breath work. What are you doing currently that you can give yourself credit for taking care of your mental health? Or maybe if you feel like, well, I'm struggling or I could be doing better, what's one small action step that you can take? Maybe a phone call or picking up a flyer or a resources or connecting with somebody. And thinking about, who are safe supports that you can connect with when you're struggling? Because I don't know about you, but when I'm struggling, my focus goes like this. And I'm not always able to think clearly. So if I know beforehand, like, okay, I have these resources, these are people that I can call, I'm struggling, then I know I can reach out to them. Because sometimes if you're struggling, it might be hard to try to look up resources and do all that because it can be very chaotic or a lot going on. And yeah, what helps you feel calm, supported, and grounded when life gets stressful? And how can you plug into and connect with those things? And in turn, too, thinking about, how can you support others? Friends, family, community members, perhaps being more present, or, if you're noticing that somebody's looking a little off, asking how they're doing and genuinely ask or be willing to listen. And again, like I always say, put on your own oxygen mask first. If you don't have capacity, like it is okay to say, you want to know what, I see that you are struggling, and here, let's get you connected with somebody who can help in this moment. And also, what does a mentally healthy community look and feel like to me? What does that look like if you were to close your eyes and imagine what would a mentally healthy community look like? Yeah. And of course, that all starts with us, right? It starts with us taking care of our mental health and our well-being, because then that ripples outwards. But yeah, thank you for allowing me to come here and share space with you, and thank you for your time and attention. Like I said, there's a million places you can be, and you chose to be here. So I just want to say thank you. And yeah, if you want to connect, yeah, I do. I'm an inner alignment coach. I also teach yoga and mom hardcore. So yeah, but happy to support people too. So thank you.
Thank you, Liz, for your time tonight, for spending time and putting some material together to share with us all about. I love your idea, close your eyes and what does a mentally healthy community look like? We're sure working hard to get there. And we've come a long way in some ways, and we always have room for improvement and growth. So thank you for those thoughts, and thank you for the things that you shared for resources and being here with us tonight. And bringing your kids, that's great to see little people here. Thank you. Yeah, okay. Thank you again. So we talked a little bit, we have a number of things that are happening in our school that are student-led, and we're very proud of the student groups that we have. And we have two groups here tonight who are very active groups and are passionate about the work that they're doing to support one another in their peers in the high school, to educate staff, and going out to even talk to younger peers, going to the middle school and talking to folks and supporting students at the middle school. So our first group that I'd like to introduce tonight are our Pledgemakers, and I'm going to let them introduce themselves and tell you a little bit about who they are and what they're doing.
All right, my name is Emlyn. I'm a sophomore, and I'm part of the business and marketing part of the Pledgemakers leadership team.
My name's Aiden, and I am one of the vice presidents of Pledgemakers.
My name is Alton. I am the current president of Pledgemakers. And before I tell you about our biggest project this year, Emlyn and Aiden would like to share some of the other things that we have done this school year.
So, as the name suggests, Pledgemakers are a student-led coalition of about 600 students here at Superior High School, where everyone who signs up takes the pledge to be drug and alcohol free throughout high school.
For our students, we put on fun events like blacklight volleyball, tubing, talent shows, and even small things like donuts on a random Monday morning. Our goal among our student body is to be examples that you don't need drug or alcohol to have a good time.
However, our board does so much more behind the scenes. Before Alton tells you guys about our biggest project yet, I want to talk about some of our smaller wins.
Last year, we presented to 7th grade health classes about the effects of drugs and alcohol that have on our lives. This not only puts us on the radar with our middle schools, but possibly prevented younger students from ever starting to substance abuse.
Also last year, our board went to City Council of Superior and expressed our concerns about the amount of drugstores in Superior and how easily it is for students to get access to substances. After hearing our testimony, the City of Superior passed an ordinance limiting the signage of vape shops, as well as not letting new ones pop up or old ones renew their licenses. This is a huge win not only for our club and our mission, but the city as a whole.
All right, now we're going to turn it over to Alton to talk about our biggest project we've ever done, the Youth Voice Project.
Thank you. We began this project in January, and we hit the ground running. Firstly, we took part in the Youth Wellness Summit, where we presented a slideshow about how big tobacco companies targeted youth in their advertisements. This summit was made up of middle school students from several schools in Wisconsin who all submitted responses to us on how vaping has impacted their lives. This allowed us to not only see the effect of vaping on a broader scale, but help spread awareness about marketing tricks by tobacco companies to all schools in attendance. We then took this presentation and made it classroom ready to present to our own school in our 9th grade Keystone classes. As of today, every freshman student who came to class when we presented knows about both the risk and tricks of the tobacco industry and how they use to trap them in addiction. We also collected anonymous responses from our students, which we can use to further raise awareness about this issue. Using the responses we received from students, we also created a video for our students to see during lunchtime, as well as worked with the American Lung Association to create a booklet to show the effects of tobacco that we are using to go to the state administration soon.
Wrong way, my bad. What you are about to hear are real stories from real SHS freshmen.
In order to protect their privacy, we've asked our freshmen to keep their answers completely anonymous.
Remember, the students you see or hear on screen are not the authors of their stories.
I hear lots of stories about people vaping in school. This makes many kids, along with myself, kind of scared and uncomfortable. I try to avoid going into the bathrooms because I don't want to see anyone sucking on a Nick stick. Makes me uncomfortable overall. To be honest, it's pretty pathetic.
My cousin introduced vaping into my life. I wanted to start because it looked cool. I didn't know how much it would impact my life.
I was 10 and my life spiraled out of control after the tobacco industry took a life to make just a few more dollars.
I've known many people who've used and been addicted to vaping and Nick. They've always tried to get me to do it, but I never did. But that just proved that being addicted to vaping doesn't just affect you, but those around you too.
I fell into addiction at a young age. I started using because I wanted to fit in with the others, but once I grew up, I realized it's not cool. Unfortunately, you don't realize you're addicted until it's too late.
Thank you to all our freshmen who responded to our questions.
Always remember, you are not alone. Reaching out can be scary, but you cannot get in trouble for seeking help.
You can get help. Vaping is always dangerous, and don't forget to reach out to staff or 988, and you can also use Speak Up, Speak Out.
All right, and those are just some of the many things that our board has done.
We will continue to work hard and expand our reach and do our part to end the vaping epidemic we face today.
Thank you all for listening.
Thank you, Alton, Aiden, Emmeline. You've done a wonderful job, and you, as representing the whole group of Pledgemakers, should be very proud. We are very proud of you. So keep working. You're making great strides, and we have ways to go yet. So we're counting on you to be here. Thanks again. I'd like to next introduce our Hope Squad. It's another group focused on mental health and suicide prevention, and I'll let them again introduce themselves and tell you a little bit about who they are, what they do, and what they've been up to. So welcome, Hope Squad.
Hi, so we're the Hope Squad, and today we're going to be talking about the importance of mental health and the role of substance abuse. But first, we're going to introduce ourselves. I'm Lila Graves, I'm 17, and I'm in grade 11.
I'm Leah Gavin, I'm 16, and I'm also in 11th grade.
I'm also Fish, I'm 17, I'm in 11th grade too.
I'm Lane McKay, and I'm in 9th grade, and I'm 15.
So we first want to talk about who we are as a Hope Squad and what we do. So Hope Squad is an evidence-based, peer-led suicide prevention group which focuses on bringing awareness and education to both the students within it and the community around it. It is a nationwide program operating in 43 states and around 1,600 schools, originating in Provo, Utah. Prior to the establishment of the Hope Squad at SHS, there were several years in a row where students had died by suicide. A survey was conducted, and it was concluded that over 50% of students would go to another student in a time of crisis or need. Our goal is to reduce the number of suicides at SHS, provide resources for those who need it, and destigmatize mental health as a whole.
So the importance of mental health. Mental health, or behavioral health, includes one's social, emotional, and psychological well-being, affecting the way you think, behave, and handle stress, as well as interact with others. Mental health is an important component of us as humans, and it shapes the world that we live in and determines the quality of life we live, facilitating our social, economic, personal, and community development. Mental health plays a crucial role in our ability to cope, make decisions, evaluate ourselves or situations, and overall function as humans, making it just as important as nutritionally sustaining our bodies.
Mental health illnesses are health conditions involving the field of mental health, typically negatively affecting emotions, thinking, and behavior. Psychological factors, emotional skills, and chemical imbalance, biological factors, substance abuse and genetics, social factors, relationships and education, and economic factors, poverty and debt, can all play a role and make individuals more vulnerable to a mental illness. Maintaining mental health is important in reducing the risk of developing new mental illness, increasing recovery likelihood, and improving overall well-being.
The role of substance abuse in mental health. Substance abuse is excessive or improper use of over-the-counter or prescription drugs or alcohol. This use can trigger changes in the brain and its functions. One way substances can affect mental health is worsening existing conditions. Pre-existing mental health conditions and their symptoms, such as anxiety, depression, or psychosis, can be amplified by substance abuse. Triggering new conditions. Substance abuse can increase risk of developing future disorders, seen in the evidential link between excessive cannabis use and psychosis. Interfering with treatment. Substance abuse can interfere with the effectiveness of therapy or medications and make it more difficult to manage mental health symptoms. Self-medication. Individuals mentally struggling may turn to substance abuse to cope with symptoms, which often further worsens the problem.
People with mental illnesses are at a higher risk of developing a substance abuse disorder and vice versa, as they feel each other's symptoms and have varying brain chemical interconnections. According to a 2022 National Survey on Drug Use and Health by SAMHSA, approximately 21.5 million adults in the U.S. struggle with coexisting substance use and mental disorders. Stimulant drugs and alcohols are associated with increasing depression, anxiety, and paranoia, while hallucinogenics can make any aspect of mental health issues worse, often causing distress and fright as well as detachment.
And finally, at the end of the day, it is crucial that you reach out if you or someone you know is struggling with either substance abuse or mental health. Your mind and life always has the potential to be of comfortable, desired quality. However, it is not often we recognize the need for change or intervention, or actually go through with executing a plan of action. This is why it's important to be educated on both substance abuse and mental health, even minimally with the information we've presented to you today, to ensure support and knowledge for yourself and those around you. We appreciate this opportunity and thank you for your time.
Thank you. Again, we have wonderful groups of students here who are dedicated to helping their peers, to making change, not only in our schools, but in the community as a whole. So we're so grateful for all of you and the work that you do. And we know, as they mentioned, that a peer-to-peer suicide prevention program and the peer-to-peer work that the Pledgemakers are doing is key. Adolescents, young people will listen to other young people more often than they do to adults. They're more willing to go to peers than they are to go to adults when they're struggling. So all of you being here is really important, and I thank you for your dedication, both groups, for the work and the time that you put into it. We know it's extra time outside of your school time to be here, and it's making a big difference. So we thank you again for being here and sharing your wisdom and your experience and the things that you're doing. It makes a difference. You matter. Thank you. We're going to make a little transition here. We have some other folks with us this evening. We have Dr. Cole Peringer from Essentia Health. Thank you. I got your name right. That's good. Sergeant Bradley Jago from the Superior Police Department, and Jen Stank, who's embedded in the police department and works alongside of our officers and doing some outreach in the community with folks who need support around mental health and other issues. So last year, as I mentioned at the start, we had some time we spent together about this time last year where we talked about opiate use in our community. And there were a lot of concerns. We're hearing trends that are happening around the nation, not just here, but nationwide, where people were struggling with the increased use of opiates in our communities and the fallout from that in terms of people experiencing overdoses, people dying because of the substances that they're using. And our conversation centered around, what do we have here? What does our community have? And what are we able to do? What are some of the gaps? What are some of the trends we're seeing? And what have we been doing? And so this was an opportunity. I've had a couple different people over that time say, are we going to come back and talk about this some more? Are we going to revisit it as we continue to hear things about fentanyl or xylazine or other drugs that are coming in that are being introduced to street drugs and fake pills that people get their hands on that are deadly? And so we had a lot of conversation about how do we deal with this as a community. And so tonight we have a little bit of an opportunity to ask some of the folks who know best to share what they're learning about and what they're hearing, and see, what's changed, what's the same, what differences are happening out there, what do we need to be aware of, and so things like that. So I'd like to start with Dr. Cole. As somebody in the medical condition, in the medical community who is an addiction medicine doctor as well as a medical toxicologist, what could you tell us from your perspective, somebody in the medical field, what are you seeing in your experience as it relates to opiate use in our community now?
Yeah, that's a great question. So people have probably, everyone here has probably heard of the opioid epidemic, which is killing a lot of people. I think one of the more terrifying statistics that I've heard in recent years is that if we take like the age group of 15 to 55, that overdoses surpassed motor vehicle accidents as the leading cause of death over a decade ago. But if you take numbers 2, 3, 4, and 5 on the list, it doesn't even equal opioid overdoses. Like that's how many people it kills in that age group of 15 to 55. You also may have heard in the news that there's been like a decrease in overdose deaths, which is a good thing. We don't exactly know why, but all these overdose deaths have increased kind of exponentially in the past decade or so because of fentanyl. You can get just as many people high with a brick of fentanyl as you can with truckloads of heroin, and it makes sense for drug dealers. And so that's what, if you get something off the street, even if it's methamphetamine, probably half the overdoses we see in the ICU, which is the other hat I wear, is from people using methamphetamine that didn't know fentanyl was in it. So fentanyl kind of drives everything and drives this huge epidemic. There's several reasons, but we see it all the time in our community. In Superior and also in Duluth, we see higher overdose rates than in any other part of the state. In Minnesota, and also learned Wisconsin as well, but even higher than in the Twin Cities. So it's a big deal, and we see a lot of it.
Thank you. Are you seeing other things that are coming in terms of how we treat this? Are there things that are happening that you see that on the horizon, or that maybe we have that we didn't have before in terms of treatment?
Sure. Opioids are different than other substances. If we just send someone to, say, chemical dependency treatment or have them go stay somewhere, the chances that they remain sober at like a year from opioids is less than 10%. It's like 8%, so pretty miserable. And then it's like Russian roulette when you use fentanyl out there. So we definitely don't have a cure for this disease. And so what we've returned to is kind of harm reduction methods. So we have medications, one in particular called buprenorphine, that there's not a medication that saved more lives in medicine in the past 50 years. You start 3 people on buprenorphine, you save a life. And it's essentially like a safe opioid that keeps people alive and helps them live a normal life. We have naloxone that helps reverse opioid overdoses, that helps people be able to engage in treatment going forward. But opioids are different, and unlike some of the other substances, medications kind of form the bedrock and are most important, but are best when combined with other therapies.
Thank you. Are there any recommendations that you would have or that you would share with people about things to be aware of?
I think for those in high school, that you never know, if you get it off the street, there's a good chance it has fentanyl. And you never know the dose. 2 micrograms, which you can hardly see, is enough to kill someone. And double a daily dose can kill someone. So just that it's really dangerous to use drugs off the street when you don't, especially what appear to be prescription medications. And so there's more and more adulterants or medication or things like xylazine that we find with fentanyl that can be really dangerous as well. And we've seen just more and more of what we call adulterants in drugs in general.
Thank you. Officer Jago, would you be willing to also address from a law enforcement perspective, what are you seeing change? You were here with us last year when we spoke about this, and you talked about what you were seeing on the streets as you're out in our community. What are you seeing today, and is there a change in what you're seeing today?
Yeah, absolutely. I'll run you guys through the numbers here. 2019, 2020, 2021, suspected overdoses here in our community in the 50s. The deaths that were suspected by overdose, 6, 7, and 6 those years respectively. 2022, 68 suspected overdoses. That was our worst as of recent. 16 were suspected to have caused overdose deaths. Fast forward to last year, 39. So we're on the way down, thankfully. 2 of those resulted in an overdose death. This year, year to date, we're halfway through the year. We've had 4, and 1 has resulted in a possible overdose death. So that's an attribute to all of the work that you guys are doing. There's a lot of resource providers out there in our community that are really helping drive that number down. It starts with our Pledgemakers and goes all the way up to all the community resources that we have here tonight. And then obviously the resources that the police department offers, our Pathways to Hope program, which is free treatment, our peer support specialist, which is out there doing the lived experience work that is so needed in our community, and our outreach worker who we brought here tonight, Jen.
Yeah, cool, thank you. When you think about, you mentioned something that, you know, this is where we are this year, halfway through a year, we have 4, right? And we've had 1 maybe death that could be attributed to an overdose death, right? So when you think about what maybe has had the most impact and what has changed and shifted from last year to now, what would you attribute that specifically to? Is there something you see as an officer?
I don't think I can attribute it to one thing, Jane. I really don't. I think that it's the resources that we have begun offering. It's the Pathways to Hope program. It's the fact that officers now, I have naloxone right here. I carry it on me. All officers are required to carry naloxone now. I carry more doses in my car. It's just that rapid response to those overdoses that we've been able to save more and more lives since we started introducing all of these programs and the programs that have been introduced in the rest of the community. I don't think you can narrow it down to just one thing.
I don't think so either, thank you. I wanted to jump in and say something. I know we talked about naloxone last year when we were here and about how many lives that can save. I want any of you who are here with us tonight and those who might be listening from home to know that naloxone is very available in our community at no cost. Vivint Health in town offers naloxone. The police department has naloxone kits that they're giving away free of charge. The Douglas County Drug Prevention Coalition is purchasing naloxone. We wrote a grant for about $11,000 to purchase naloxone. That will be coming. I think there are a number of partners around the community who have recognized that we need to carry naloxone. And I think in the beginning, in my experience, people were a little reluctant. They weren't sure about carrying it or using it and what role that would have. For those of you who may not know, naloxone is a medication that will reverse the effects of an overdose temporarily. So if somebody is overdosed and they've gone out, you can administer naloxone. And we have nasal naloxone now, so in the beginning we had injectables. Those are still available. We have a lot more nasal naloxone, so that's much, I think, more comfortable for people to use, with lots of instructions about how to use it. And the other thing that I think is important for people to know about naloxone is if you're not sure what somebody has taken, you can safely administer naloxone. It won't hurt somebody if they've taken a drug that's not an opiate. But if they have taken an opiate, it can reduce the effects of those opiates, bring them back long enough for first responders and paramedics to arrive and get them to the hospital and get the help that they need. And I think, as you're talking about, we've had lots of community members, lots of community agencies, and lots of organizations around town recognizing that and having naloxone in their buildings, in their offices. We have it here in our through the district. All of our school nurses have it available if it would be needed. So I think the awareness building of what that can do, we can't save people's lives if they've died. So if the more we can have naloxone available for people, it offers hope. It's hope for recovery if we can use naloxone when it's available. What else, are there other things that you would offer in terms of what you're seeing Dr. Cole talked about the adulterants, the other things that are being added. What are you seeing in the streets in terms of other drugs coming in, or what are we seeing most of?
Yeah, it's certainly not uncommon to see fentanyl mixed in with pretty much everything that would be available on the street. Methamphetamine in particular has been increasing. We've even seen somebody who has had a headache and they've bummed a prescription medication like a hydrocodone off of a friend, and that turned out to be a fake pill that was pressed. And I'll tell you, they look almost identical to the real prescriptions. It's very hard to tell the difference between a legitimate M30 and one that's been pressed out on the street. And that can result in an overdose. We talked about how little amount of fentanyl is required. And then of course we have other fentanyl, I believe derivatives would be the correct word, carfentanil, things like that are even more potent that can be in that. And then of course xylazine, which is the up and coming. Naloxone does not work, to my knowledge, with xylazine, so that is also something that hasn't hit fully yet like it has in other parts of the state, but unfortunately it is here.
Thank you. Jen, are you willing to talk about some of the things you might see? Your role with the police department, you're embedded in the police department and you're working with folks. From your perspective, what are you seeing and what are you noticing with folks that you are interacting with in terms of drug use and the need for support and what we can do to offer people help?
Yeah, absolutely. Hi, everyone. I'm Jen Stank. I'm the Coordinated Response Specialist for the Police Department. A lot of police departments across the nation are embedding social workers, outreach workers, just to work alongside law enforcement to combat a lot of these issues that we're seeing in our community. So I came on board with the police department in 2021, so I've been there for about 3.5 years. And we've seen a lot. So we do a lot of outreach. We'll go out into the community to try to connect to people. That's our goal, is to make people aware of our program, that we want to help everyone in our community. We want to reach all populations. So we do events like this, and we go out into communities. We go to homeless encampments. We work a lot with folks who are unsheltered, trying to get them connected to the resources. That's where we do see a lot of substance use with people who are living unsheltered. So we try to get them connected to resources, or just keep doing outreach and keep showing up, so when they are ready, they know where they can go to get help. As you mentioned, we do have Narcan at the department. We have an overdose outreach, so we try to follow up with people who have overdosed. All of our officers, they do carry 2 doses, so they can administer one and they can leave one behind. We have overdose prevention kits that we leave behind also, where there might be suspected substance use. And in there, we're also tried the harm reduction model. So we want to get the materials out there. So in our overdose prevention kits, we have xylazine testing strips, we have fentanyl testing strips, we have resource cards, we have Narcan, and instructions on how to use Narcan. And it's the nasal Narcan, so it's pretty easy to administer, like Jane said. So we're trying to get that out into the community as much as possible. But there are a lot of people in our community who are struggling, and what they need is that connection to resources, connection to friends, to family, and that's where we're seeing people be more successful. And we're always trying to grow our program. You've heard a lot tonight about peer support. We have a peer support as part of our program. Our program pays for her. She is a graduate of our program, so she's got lived experience with substance use, mental health, homelessness, and navigating a lot of systems. And it's just one more way that we're forward thinking of how we can try to reach more people. And she's helped us connect a lot more people to our program.
Cool, thank you. Are there any other things, words of wisdom or things that you would offer to the folks who are here tonight about how to support that? What could we be doing more of from your perspective? Are there things you've thought about that we could be doing that would be helpful?
I think the best thing is to keep attending events like this and keep yourself educated. And when you see that somebody's struggling, just be there for them, walk alongside them. They're not going to be ready until they're ready, but be ready with the resources. You can reach out to me at any time. I'm right at the police department, and I can reach out to, I do a lot of cold calling, so just be there and be supportive without enabling, and just like reach out if you've got questions or with a certain situation, and we're happy to help any way that we can.
Great, thank you. I think one of the things that, to address an issue like this, as we've heard tonight, it takes more than one person and one avenue. We need people from the medical field. We need people in law enforcement who are interacting daily with folks who are struggling. And even before then, so we're working on intervention. We're trying to find ways to intervene and help people, when they're ready, have the resources necessary to make the changes to become healthier. And even before that, though, we can talk about prevention, and I think that's where the Pledgemakers and Hope Squad come in. If we can start early, the earlier we start with prevention, the less likely it is that people will begin to use. We also know that even if we don't ultimately prevent it forever, the longer we can delay the onset of use, the greater the likelihood is that that person will not have a problem. The younger you start, data tells us the younger a person starts using substances, the greater the likelihood is that they will have a problem with it as an adult. So the prevention work that we do here in the school with groups like Pledgemakers and Hope Squad talking about substance use and the interplay of substance use with mental health is key. They're doing a great job educating one another, their peers, and they're educating staff, by the way. These folks have presented to staff at all staff days and brought material to our staff members to help educate them too. And that's been really powerful and well received by the adults in this building too. So we have prevention, we have intervention, we have treatment, right? And then how do we support people once they're in treatment? It takes a village, and what I would say, and I don't know if you would agree with me, Dr. Cole, but I think, we have a lot of, we look for medicines and we look for treatment, but I think substance abuse and addiction is a disease of isolation, and recovery comes through connection, in my experience. And people tend to isolate, people tend to move away from families and friends, and as they grow in their addiction, and I think recovery comes with connection, and that's all of us doing our part, all of us doing the pieces that we can do, whether that's reaching out a hand to say, hey, I see you, I see you're struggling, as Liz talked about, like, how can I help a friend? Am I noticing that things might be difficult, right? We talked about some of the student groups of how people use different drugs to mask maybe symptoms that they're experiencing of a mental health challenge. So the more aware we can be about what people notice, just notice. Are people changing? Are they different? Can you notice that and say something? And be mindful of what folks are experiencing and find a way to reach out. And maybe there's a connection made there, so when they're ready, they'll reach back, right? And we're able to make some movement and provide some support for them. Again, I think there's a lot of things that are going on in the world, and I think one of the things that comes with, we need to educate people, like tonight, to talk about what's happening, to know that there are fake pills out there that look so much like the real thing that you can't tell the difference. And some of them look so real, I think the only way you can tell the difference is to actually test them. And so kids, and here's, just from a perspective of somebody who works with teenagers and, young people, I hear a lot of young people say, my friend would never give me something that would hurt me. And I say, you're right. I don't think your friend would give you something to hurt you deliberately. But your friend gets something from somebody, right? And they get it from somebody. And ultimately, a lot of the stuff that they're getting looks very real and comes from cartels and other people who make these things up, to make money, who don't care about what's in it and what the impact is on the people who are ultimately buying it. And so the education and the prevention work also is a huge piece, and I think this community is doing a great job. We're doing good in schools. We have lots of people in our community who are working hard to get the word out and support the folks in our community who are struggling, who maybe haven't started yet, but are struggling. We're reaching out, right? We're trying to find ways to support them, and reaching out to people who are using. Right? There are things that we can do to help them get ready to move into recovery. We have resources available, and we have resources available to all of us that we could carry and have with us, whether that's knowledge to share or having Narcan available or telling somebody about Pathways to Hope. There's treatment available, there's treatment options, and the police department has a wonderful program. And maybe, would you like to say something about that, one of you, Jen or Sergeant Jago talk about Pathways to Hope, the treatment?
Yeah, Pathways to Hope is our treatment program. It started in 2018. It's a dual pathway to hope, essentially. You can refer yourself by coming to the police station. You can talk to any officer out on the street. Any officer can refer you to the program. If you meet the requirements, which are very minimal, it would be free. Inpatient and outpatient treatment, which is hard to find these days, a free treatment program that offers inpatient as well. So we have that option. Totally funded by a grant from the state of Wisconsin, the federal government. It's it's a great resource. It's utilized very regularly at our department. The other option to get in is criminal diversion. So if you're arrested for an offense that matches our list of offenses that qualify, simple possession of methamphetamine, opioids, etc., you can be diverted on those criminal charges, so you would never it wouldn't be on your record. You would go to treatment instead of jail, and it would never be on your criminal record. So it's a very important program for this community, and it's been running since 2018.
Yeah, thank you. I think those are some of the things that not everybody always knows about or hears about, and I think it's important for us to know that there are a lot of people in our community who are working hard to bring the resources that we need here to help folks on multiple levels. So again, I think as we are in this month of May where we're paying attention to mental health, and you can't separate mental health and substance abuse and substance misuse, they overlap, that we are grateful for all the things we do have. I know there's more things we could have that would be great to have, and we're working on that all the time, trying to bring in more resources, but know that there are resources and there are folks out here who are willing to share their knowledge, bring the resources they have, make them available to this community. So please don't be afraid to reach out. Hopefully you had a chance to be out at the tables tonight, visit some folks and learn about some of the things that are happening in our community that are available to all of us. And I would hope that we get to do this again next year, and maybe next year we come back and we hear that we have even smaller numbers and that we're making a greater impact, and it's very nice to hear the shift. We have more things coming in that we need to deal with, but to see the numbers dropping for the efforts that this community has made is very rewarding. So thank you for all of your wisdoms and the pearls that you've shared with us this evening and helping keep us on board. I also would be remiss if I didn't mention tonight the people who helped us put this all together. We had sponsors this evening. Essentia Health was a sponsor tonight, NAMI, Lake Superior South Shore, our school district, VIP Pizza. You know, we have our student groups who showed up. For everybody who's here tonight, thank you for all of the efforts that were put into making this a successful evening. And for those of you who attended online or in person, thank you for being here. We have some time. If there are questions, we'd open it up to some questions if there's anybody that has a question for any of our speakers tonight. I can't see, so it's better. Okay.
Speak into a microphone if you raise your hand and want to ask a question of our experts.
Carrie has a microphone, so if you have a question, we could all hear it. Okay. Hearing none, thank you so much for your attendance, and thank you for everybody who spoke tonight. Thank you. We'll see you next year.
And before we go, I also want to make sure that we do a drawing because many of you entered your names into the drawing. I'm going to ask our middle school Hope Squad reps that are here today, somebody to draw a name out.
Lexi Nevin.
If Lexi's here, you can grab your basket on the way out. Otherwise, we'll look you up by your email. Thank you, everybody.
Thank you. Have a good evening, everyone. I'll see you next year.